Good afternoon, everyone. Welcome back to my channel. Um, in German, I would say Guten Morgen and alles. Wie geht es dir? That means good afternoon, everybody. How are you doing all? So this afternoon, I want to talk about how long, the topic that my patient used to ask me very often, and how long does it take to get pregnant after successful Caesarian section. That is after successful section of the Caesar, that is operation to deliver a pregnant woman. That how long do they have to wait before they get pregnant again? Yeah, it's an interesting question. I had a patient last week that came, so and I said let me make a short notes or a short voice record concerning this topic. Usually, we expect a mother, a nursing mother, to wait for at least 18 months after having cesarean section. So, after having the section of the Caesar, it is expected to wait for like 18 months. That is the expected timeline. And why do we have to wait up to this time interval? Number one, the womb needs to recover. We call it, recovery from cesarean section. The womb needs to come back to normal because there are scar complications if you get pregnant below 18 months. Actually, that does not mean that people cannot get pregnant after 6 months, after 1 year, but the risk increases if we do not wait up to 18 months after delivery via cesarean section. So the complication that we can see if such happens, if one gets pregnant before 18 months, you can have a scar complication, including uterine rupture during labor. You can have preterm birth. You can have low birth weight, baby. Yeah, you can have maternal anemia. What I mean by that is that the mother has not actually gotten a good pool of red blood cells before getting pregnant again. So this mother can become short of blood, during the process of getting pregnant below 18 months after delivery via cesarean section. That is the operation that doctors used to do for delivery of mothers with various indication, whatever indication can be, maybe. Also, there can be pregnancy complications too. So, we recommend that usually strictly between 18 to 24 months. Why do we usually advise 18 to 24 months? The reason is that we want the uterine scar to heal. You had cesarean section, the scar has not yet healed, and you want to go ahead to get pregnant again. So, the uterine scar healing has not properly completed. If you go ahead at less than 1 year, 18 months thereabouts, or 1 year thereabout after cesarean section. So if you wait up to this level, you are having a reduced risk of uterine rupture. The womb will not be able to rupture again. At least after 18 months, the womb is back to normal and cannot become ruptured again during labor. That is, if you are going to through trial of labor after cesarean section, or vaginal birth after cesarean section, VBAC, or probably you want to have a repeat CS, provided that there are clear-cut indications for that. So again, uterine scar healing, you want to ensure that one takes place very well. Reduce uterine rupture if you wait up till 18 months. Yes, better maternal recovery, mother will recover very well, like blood loss can be minimal, breastfeeding can be adequate, recovery from anemia can also be good. There is restoration of lost nutrition, restoration of nutritional reserve will be well adequate if you wait up to 18 months. Then healing of the abdominal and pelvic structures, of course the anatomy of uterus and rectum, and some some spaces between rectum and the uterus will have enough time to heal and the pelvic floor muscle also will have enough time to rest if you wait for up to 18 months. Then better outcome for the babies too is part of what we are looking at. If you wait up to 18 months, studies have shown that people that deliver after 18 months of having cesarean section, they tend to have less premature birth. Okay, that the baby gets to maturity very well, and then low birth weight is not in their dictionary. The baby will have a good weight, and then the baby may not be a small for gestional age infant. It will have, a good gestional age when or during the time of delivery. So again, what if conception occurs earlier? Less than 6 months after cesarean section, the risk is very high. The risks to the baby, the risks to the mother, the risks to the womb. So 6 to 12 months after cesarean section, we can have a moderate risk. Then 12 to 18 months, the risk can decrease significantly, and 18 months or more is generally considered optimal to give birth after having cesarean section. So the practical example I want to cite here is that if someone had cesarean section in January 2026, it is ideal for such a person to conceive around July 2027 onward. So you can see here that 18 months has gone past, and then anytime after that, yes, a woman can conceive after having cesarean section for at least 18 months after the operation. So if conception occurs January 2027, according to the example that we cited now, many women can do well, but the pregnancy may require closer monitoring. Yes, we need to monitor the pregnancy closely. So recommendation now will be that what does most gynecologists do? If you're considering vaginal birth after cesarean section, at the after going past the interval of 18 months, then you are okay, you are considered optimal. But if it is below 18 months, that is, if you have a short interpregnancy interval, what do I mean by that? You conceive around 6 months, 8 months, 10 months, 12 months after cesarean section. So we call that one short interpregnancy interval. This is as against normal delivery. So we are talking about cesarean section now, conception after cesarean section. So you need to see a qualified obstetrician and gynecologist who could actually place you on a closer monitoring and ensure that there is safe motherhood, safe childhood, safe delivery, safe antenatal, and then safe delivery procedure, and then post-delivery, care is adequately given. If you like this talk, follow, like, and share. I am Dr. Olubayo by name. I will say thank you for watching. I will say danke in German, and I will say shukran in Arabic. I will see you later. Tschüss in German, that is bye bye, or auf Wiedersehen. I'll see you later. Goodbye. Take care. Bye.